Good morning and welcome to our third day of the Pflugerville Seniors Conference. My name is Rob Fabian with Age of Central Texas, and along with our co-hosts at the Pflugerville Community Church, we are so glad that you're joining us today. We have a great presentation talking about brain health. And as you know, if you've been attending our conferences over the past several years, this is our 5th annual year to do the Pflugerville Seniors Conference. Normally, we would have had it back in May, and we would have had it in person, but of course, COVID had a whole different idea for us. But we didn't want to miss the opportunity to bring you these great speakers that we had already scheduled for the conference. So we decided we're going to go virtual. Now, this is the first time we've done this conference virtually, so we are learning as we go. So if along the way we have a technical issue or two, please forgive us. We're learning as we do this, but again, we wanted to have the opportunity to bring you all this great information, so we didn't want to miss that opportunity. Before we get started today, I've got a quick video I want to show you. We have some fantastic sponsors who have helped underwrite the cost of doing the conference this year, and one of those is our friends over at AARP Texas, and I wanted to show you a video that they had prepared for you.
Family caregiving is a priority for AARP. It's essential to our work today, but that's not all. AARP is doing amazing things to make life better for the age 50+ population and generations that follow. We help people improve their financial well-being and their health. We want people to contribute to society and local communities and to fully enjoy life. Let's take a moment to discover more about what we're up to at AARP.
Our story begins more than 60 years ago inside an abandoned chicken coop where our founder discovered a retired teacher living, no home, no health care. So she said no to this injustice and yes to transforming lives. It's this drive, this compassion that inspired AARP. Today we empower people to choose how they live as they age. We advocate for health and financial security. We strengthen communities everywhere. We are AARP, creating real possibilities.
I want you to know that AARP has a strong presence throughout Texas in many communities in this great state, including Austin, the capital city where I live and work. This year, AARP Texas is bringing opportunities to our members and others through virtual events like this one we're participating in today, and on platforms like Facebook Live. We hope you have the opportunity to enjoy these free offerings. Not only are there programs to help unpaid family caregivers, but there are presentations to help people avoid being the victims of fraud. We host fitness seminars, and we work with city leaders towards making this an even more age-friendly community. And know this, volunteers are critical to our mission. There are many opportunities for those who can give a little time to volunteer. You can learn more about these local happenings at aarp.org/tx or catch us at the AARP Texas Facebook page. Again, of course, family caregiving is a priority. Here in Texas and across the country, AARP is working with governors, state legislators, and community partners to take common sense steps to support America's 40 million family caregivers. We know that caregivers help their older parents, spouses, and loved ones live independently at home. And right now, AARP is fighting to protect nursing home residents against sickness, neglect, and isolation during the COVID-19 pandemic, while also educating family caregivers on how to advocate for their loved ones. Sadly, more than 62,000 nursing home residents and staff at those facilities have died from COVID-19, and the death toll continues to mount. These are mothers, fathers, grandparents, and spouses with families who love them. Nobody should be going through what nursing home residents and their families are experiencing today. Families want elected leaders to take action now to protect residents of nursing homes and other long-term care facilities. Right now, no state is doing a good enough job to protect these residents and staff. Congress must take immediate action to provide regular testing and personal protective equipment for residents and staff. There should also be timely and reliable reporting of COVID-19 cases and deaths. There also must be virtual visitation allowed for families. And finally, we urge lawmakers not to let nursing homes off the hook for abuse, neglect, and even death. Now is not the time to strip away the rights of nursing home residents. AARP will continue to fight for family caregivers and other families. We appreciate your support and for listening. We have many resources available for family caregivers just like you. One place to go for information is aarp.org/caregiving. Thank you for listening, and thank you for all that you do as family caregivers or to support caregivers.
Thank you so much, Jessica, and thank you to all of our sponsors for this year's Pflugerville Seniors Conference, and especially to our presenting partner and sponsor, Baylor Scott and White Health. If you missed yesterday's great presentation from Dr. Theoptisto from Baylor Scott and White Health, you can go to our YouTube page and you can watch that video along with all the videos from this week. We are recording all of our videos, so if for any reason you have a technical issue and you get kicked out today, don't worry. You'll be able to watch the full video after today. We will upload it this evening and it'll be on our YouTube page. Just go to YouTube and search for Age of Central Texas, and you'll find all of the videos that will be from the session. At the end of this week on Friday, you're also going to get an email that will list all of the YouTube links, so you'll be able to go back and watch all of them again if you want, share them with friends. We're also going to send you a survey, and we ask that you please fill out the survey and email it back to us. It's online, be very simple, because we want your feedback. We want to know what sessions you want for us to prepare for next year. And I guarantee you we read every single one of those surveys. So let us know, what did you like? What didn't you like? What can we do to make this session better? Because this is for you. That's why we are doing this, is because we want you to have the resources, the information, and everything you need to be able to age successfully here in Central Texas. We also sent you a link to the program when we sent you the reminder for today's session. Please take a look at that, because it not only has information on all of our speakers and great materials from our sponsors, but we also included some wonderful resources for you of things that are right here in Central Texas that can be a benefit for you. So be sure and take a look at that. Finally, right down here on your window, you have a chat feature. It looks like one of those thought bubbles or speaking bubbles from the comic strips. We want you to use the chat today, because we're going to have a Q&A at the end of our session. So while we're presenting today, ask your questions. Again, this is for you personally. So we want you to have the opportunity to have all of your questions answered by our experts who are here today. And if for some reason we end up with a lot of questions and we're running long, because we do want to honor your time, we said we would stop at 11:30, and that's what we're going to do. If for some reason we get a lot of questions and don't have the opportunity to answer all of them live today, do not worry. We are still going to answer your question. We will send you an email with a direct answer to your question. So don't be afraid to ask those questions. We want you to have this opportunity to learn as much as you can about brain health. All right, let's get right to it. We're very excited to have Casey Lawrence with us today. She is a licensed social worker specializing in working with older adults. She has more than 5 years experience working with older adults in skilled nursing, home health, and community settings. She received her Master's of Social Work from the University of Texas at Austin, and she also has a certificate in nonprofit studies. She currently serves as the program director for the Memory Connections program here at Age of Central Texas, and she is also the co-founder of the brand new Virtual Connections program, which we're going to talk about a little bit as well. Casey, we are so glad to have you with us. Thank you so much, and I am going to turn it over to you.
Thank you so much, Rob. It's such an honor to be here with you all today. Thank you so much for having me. I hope that you will find this presentation to be useful and helpful, and please do share all of your questions, because I want to provide the information that will be the most useful to you today. I'm going to go ahead and share my screen so that you can look at my presentation with me. Okay, hopefully you all can see that okay. Again, thank you so much for having me today. Today, I'm going to be talking about brain health and aging. So what changes in the brain can we expect as we age? When should someone be concerned about their memory or thinking? What are the next steps to take if there is a concern? What are the symptoms of dementia? And what can be done to promote brain health? And then finally, where to go for help and support. I'm so glad that you've joined us here today. I know that this is a topic that lots of people have questions about, and it can often be a topic that's difficult to talk about at times. So I'm hoping that you find this education and information helpful, and also some of the strategies that I suggest for starting these conversations to be helpful as well. I'd like to start by talking about why and how the brain changes as we age. So forgetfulness can be a normal part of aging. However, aging does not result in an inevitable loss of cognitive abilities. As people age, both the body and the brain change. All of us that are aging know that, of course. Parts of the brain may shrink, especially areas that are important to complex mental activities. Communication between neurons or nerve cells may reduce. Blood flow to the brain may decrease. Inflammation may increase in the brain, but the brain remains able to adapt to new challenges and tasks. And it's not clear why some people's brains age better than others, just like it may not be clear why some people's bodies age more healthfully than others. But cognitive reserve may play a role in brain health, and that's the brain's ability to work well, even when some part of it is disrupted. And that could be related to education level. The research about this topic is absolutely ongoing. So the signs of brain changes as we age include more challenges with multitasking, taking longer to complete tasks, increased difficulty finding words, maybe small decreases in the ability to pay attention, and a harder time finding things that are often used, such as keys or glasses. But individuals can still learn new things. It may take a little bit longer. They can still create new memories and still improve vocabulary and language skills. And scientists have found that given enough time, older adults do as well on complex memory or learning tests as younger people. In fact, as they age, healthy adults usually improve in areas of mental ability such as vocabulary. And so while certain areas of thinking do show a normal decline as we age, others remain stable. And that's what I would like to talk about next. So as we age, different aspects of cognitive function change. So some areas of that cognitive function remain stable and some areas change. And that's what these next two slides cover. So in the area of intelligence, as it relates to cognitive function, crystallized intelligence tends to remain stable as we age. So the knowledge or experience accumulated over time. But fluid intelligence may decline as we age. And those are abilities not based on experiences. So the ability to think and react quickly, mental multitasking, or learning new information, those things may be more challenging as we age. Memory is usually relatively preserved as it relates to long-term memory. So the ability to recall past events that have been stored over many, many years, that is likely to remain stable as we age. But short-term memory is more vulnerable to the changes in the brain that are associated with aging. So recent memory or the formation of new memories, taking longer to learn new information than before, so having to see or hear new information more times in order to retain it. In the area of attention, simple or focused attention remains stable. So watching one television show, that level of attention is going to remain the same. But divided attention may become more challenging. For example, trying to pay attention to the television and simultaneously talk on the phone, that can become more challenging. So in the area of language, verbal abilities are often preserved, including vocabulary. So we still are able to have that vocabulary, but finding the word that we want at the time that we want it can become more challenging. When we're in spontaneous conversation and we're trying to recall someone's name, The information's not lost, but it can be more difficult to retrieve when we want to retrieve it. In the area of reasoning and problem solving, the ways that we have learned to approach and solve problems over the course of our life, that is retained. So the wisdom that we have learned over our many years of life can sometimes lead to better approaches to some problems than other people who have not had those experiences, which makes sense. But as we encounter new problems as we age, things that we have not encountered before, things that are completely new to us, those may take longer to figure out because we have not encountered them before, and our brain's ability to figure those out spontaneously may be a little bit challenged. So new things could be harder to figure out. And in terms of our processing speed, our ability to process and perform activities remains, but the processing speed may decrease. So we may need more time to take in information and formulate a response. So complex tasks that require a lot of that can become very difficult. And this especially relates to driving, which I know can be a difficult topic for people to talk about as they age. But that particular task requires the brain to continually notice and process a lot of new information and quickly formulate an appropriate response. And that can become more challenging as we age. So hopefully this demonstrates to you exactly how the different aspects of cognitive function may change as we age if there are no additional physical things happening in the brain that may cause changes beyond what we might expect in normal aging. So I feel like now we have a hopefully pretty good picture of what our changes happen in our brain as we age for all of us. And now I'd like to talk about what are some of the problems that we may notice as we age that are beyond what happens to all of us. So I'm talking about serious problems with memory or cognition that make it hard to do everyday things. So that could be asking the same questions over and over again, getting lost in familiar places, not being able to follow instructions, becoming confused about time, people, and places. Forgetting how to make change or use the telephone. Again, these are things that are probably stored in long-term memory. That's going to be a serious problem. Difficulties with driving, again, kind of maybe a gray area, as I just discussed. Not taking care of oneself, making poor decisions or judgments, misplacing things often and not being able to find them, trouble having a conversation or forgetting the names of everyday objects, and changes in long-held habits. And I really want to highlight that one. So if someone, in the past had a very neat house, kept a very neat house, and that was really important to them, and then perhaps we're noticing that the house is becoming messier and significantly messier, and there isn't another thing going on that might be causing that, obviously. Or someone who used to really enjoy talking and interacting with other people and meeting new people suddenly is very withdrawn and is saying no to a lot of social invitations and not doing things that they would usually do. So these are things to keep an eye on, is really a shift in what the person has done before. So hopefully this gives you an idea of some of the things to look out for that would be concerning in terms of problems with memory or cognition. Now I'd like to talk a little bit about the risks to brain health. So something that I like to say is anything that's detrimental to your overall health is also a risk for brain health. So all the things that your doctor might say to you about how to promote your overall health, those things are also going to promote your brain health, which makes sense. So I'll just go through these quickly and how each of them contributes. Smoking reduces blood circulation to the brain. Drinking too much alcohol can result in slow or impaired communication among brain cells, even with moderate use. And it's important to note that alcohol can affect older adults different than younger people, as well as there being possible medication interactions. Undiagnosed or untreated diabetes, heart disease, high blood pressure, other health problems. Those are all risks to brain health as they can cause blood vessel changes in the brain, increased risk stroke, and sometimes people are not aware that they have these issues. So it's really important to get your well checks regularly with your doctor. Risk of head injury may be something that people don't think about as a risk to brain health, but a lot of us as we get older think about the risk for falling. And older adults are at a higher risk for falling and other accidents, and those can cause brain injury. And so think about reducing that risk by doing exercise to improve balance and coordination, maybe taking a fall prevention class, think about ways to make the home environment safer, reviewing medications and vision regularly with healthcare providers, using adaptive equipment as recommended. So if a professional has recommended using a cane or a walker, using those things surprisingly are very important for your brain health because they are reducing your risk of falls. And then of course, getting enough sleep. Social isolation and reduced social activity, which we are all experiencing right now, have a very large connection to physical health. So social isolation can lead to poor physical health. You may have heard the statistic that social isolation can take the same toll on your health as smoking 15 cigarettes a day or something like that. So it's really important to keep an eye on this. And social isolation and low social activity can increase the risk of cognitive decline and dementia, as well as increase the risk of mental health concerns such as depression and anxiety. And we're going to talk a lot more in detail about some of these things. But depression can affect the physical structures in the brain. And these could be physical changes like inflammation or oxygen restriction to actual shrinking of the brain. Poor diet is a really important thing to consider because our brain uses a lot of nutrients and needs those in order to function well. And what you eat does directly affect the function of your brain. I already mentioned insufficient sleep. So during sleep, the brain forms connections that help process and remember information. So lack of sleep, as we all know, can affect overall health, but it can also affect our short and long-term memory. So I'm going to talk, physical activity. I'm so sorry, I missed that one. So physical activity is really good for your overall health, and some research shows that physical activity may be a factor in decreasing risk for cognitive changes as we age. And sometimes people ask me, is there a genetic risk of dementia? And so I wanted to mention that here as well, that while genes may play a role in dementia, as they do in overall health, these lifestyle changes are a way that we can reduce our risk for dementia. So really thinking about what are the things that we can do? How can we be proactive? Because we can't do anything about our genetics, but knowing that these lifestyle changes can impact your brain health is really good to know that you can take action toward improving your brain health. Excuse me. I want to talk a little bit about treatable medical conditions that may cause memory loss, because I think sometimes when someone is experiencing a change in their memory, I think people, as we do as humans, sometimes we go to that worst case scenario. What if it's incurable? What if it's dementia? What if it's going to get worse over time? And when I'm talking to people, I really like to highlight this, that there are medical conditions that are treatable, that when you treat them, your memory or your cognition does improve. And that's why it's so important to go see a doctor. I have known people who had medication side effects that caused changes in memory or cognition. And once they worked with their doctor and changed that medication, they found their memory or cognition improves. And same with depression. So I really want to highlight this for you and try and, if I can, reduce some of that fear and stigma about going to your doctor and talking about these issues, because there is a lot that can be done about it. And it may even be something that's curable. So some of those things are vitamin deficiency, tumors or infections in the brain, thyroid, kidney, or liver disorders. I already mentioned medication side effects, and that could be a combination of medications or combining medications with alcohol. It's really important not to change any medications without checking with your healthcare provider. but it is a really important thing to consider. Insufficient sleep or sleep apnea and untreated depression, that I'm going to talk more in detail about. There's a lot of aspects to those. But again, I just really wanted to highlight that there are things that are treatable that cause changes in memory. So you may be familiar with sleep apnea, but you may not be. So I really wanted to cover this and make sure that everyone knows about this because it can have such a big impact on your brain health. I've known individuals who have gotten diagnosed and treated for sleep apnea who have said, you know, I really noticed that I was able to think clearer and I was able to focus better and my memory seemed to improve and I just felt better once I had my sleep apnea treated. So that's why I wanted to talk with you about it today. So sleep apnea means that you have one or more pauses in breathing or shallow breaths while you sleep. Breathing pauses can last from a few seconds to minutes and may occur 5 times or more per hour. Then normal breathing starts again, sometimes with a loud snort or a choking sound. Untreated sleep apnea, of course, affects our brain health, but can also increase the risk of high blood pressure, heart attack, heart failure, stroke, diabetes, accidents, so many different things. So the signs to look out for are restless sleep, loud snoring, like I just mentioned with that silence followed by gasps, falling asleep during the day, headaches in the morning, trouble concentrating, irritability, moodiness, forgetfulness, all these things. And treatment begins with lifestyle changes and talking with the doctor. Not everyone who has these symptoms has sleep apnea. You'll probably notice as I go through my information today, there's a lot of overlap in a lot of these symptoms. Some of the symptoms of dementia and sleep apnea and depression, like trouble concentrating and forgetfulness, there's a lot of overlap there. And that's why it's so important to talk with your doctor to figure out what is causing those changes to try and get the support that you need or the treatment that you need. I want to talk next about depression. I think this is something that is hard to talk about. It's often misdiagnosed and undertreated, especially in older adults. There's a lot of stigma around depression, I think. Culturally in our society. I really want to highlight that depression is a treatable medical condition. It is not a normal part of aging. Older adults are at an increased risk for experiencing depression. And if you are concerned about yourself or any family member, it's really important to talk with a healthcare provider. The reason that older adults are at an increased risk is about 80% of older adults have at least one chronic health condition, and 50% have 2 or more chronic health conditions. And depression is more common in people who also have other illnesses or whose function becomes limited. And older adults are often misdiagnosed and undertreated because healthcare providers may mistake in older adult symptoms of depression as just a natural reaction to illness or life changes that occur as we age, and therefore not see the depression as something to be treated. And that can happen with the people in the older adults' lives as well. And the older adult themselves may share this belief and may not seek help because they may not understand that they can feel better with appropriate treatment. The good news is the majority of older adults are not depressed. Some estimates are that 1 to 5% of older adults in the community are living with depression, but it can go up to as high as 13% for older adults who are using home health care or are in the hospital. Finding a way to talk about depression is really important. Thinking about the individual or yourself, what benefit of depression treatment might appeal to them? So perhaps really focusing on how depression is treatable and can improve quality of life may help someone be open to seeking treatment. So not focusing so much on the symptoms or the problem, but really focusing on how to live your best life could make the conversation go easier. I really want to highlight that the symptoms look different in older adults. So we often think of feelings of sadness or hopelessness or crying all the time as a symptom of depression. And certainly those things can happen. But in older adults, we may notice other symptoms first or more often. And those symptoms are irritability or grumpiness, tiredness, fatigue, or decreased energy, difficulty sleeping, early morning awakening, or oversleeping. And you may notice that these symptoms also could go along with so many other things in life. And that's why it's so important when you go to the doctor to say, hey, I know that depression is really common in older adults, and just to be sure I'm living my best life, would you screen me for depression today? Other symptoms to look out for are lack of motivation, difficulty focusing, loss of interest, changes in eating, unexplained physical symptoms that don't have a clear cause or that don't get better with treatment. And of course, having thoughts of self-harm, and definitely call 911 if there's a concern about that and get help. As I've been mentioning, there's lots of overlap with dementia symptoms, but it's really important to know that depression is treatable. And with treatment, people feel better and their symptoms reduce and their cognition can often feel better. There's medication, there's talk therapy, there's getting support from family and friends, and physical exercise. All these things can help actually with both people feeling better with dementia and depression, but especially with depression, they can help people feel better. So my hope here really is to kind of demystify depression, reduce some of the stigma, and really encourage everyone, if they're concerned about depression, to seek help, because it is treatable, and with treatment, quality of life definitely improves. Okay, so now I'd like to go into talking about some of the different diagnoses that are related to memory or cognition. So these are things that when you go to the doctor, and I'll talk a little bit about the diagnosis process in a bit, but that when you go to the doctor, the doctor says, this is your diagnosis related to memory or cognition. And at this time, there is no proven treatment that cures or reverses these changes in the brain. I really wanted to go over what these different diagnoses mean and what they look like, so that if you hear someone say these, or if you or someone you know goes to the doctor and gets one of these diagnoses, you're familiar with them and what the symptoms are and what they might look like. So mild cognitive impairment means more cognitive changes than expected with aging, but fewer than dementia. And we're really looking at, compared to others of the same age or education level, and changes that are noticeable in that person by family or friends. Many abilities and strengths remain. So the changes are usually not severe enough to significantly interfere with daily life and usual activities. And someone living with MCI is still able to perform daily activities, managing the household, maybe managing their own medications, or even managing the finances if they have always done that. There's no single cause of MCI, and it often develops from the same brain changes that happen in dementia, but there's fewer of those changes in the brain, so the symptoms are not as severe. Symptoms over time may stay the same, but there is a higher risk of developing dementia if someone has MCI. So 10 to 15% of people with MCI go on to develop dementia, where it's only up to 3% of older adults. And I've listed some of the symptoms here, some of the things to look out for. Short-term memory problems, losing belongings more often, challenges with learning and remembering new information, more trouble coming up with words, losing plots of books or movies, or having trouble keeping up with group conversations, feeling more overwhelmed by making decisions or planning steps to accomplish a task, more impulsivity or poor judgment, and then of course, depression, irritability, anxiety, and apathy. Again, so many of these symptoms overlap. It can be challenging to tease out which one is happening, and that's where a medical provider is very, very helpful. So let's talk about what dementia is. So I often get the question, what's the difference between dementia and Alzheimer's disease? And so that's what I'm hoping to talk about in this presentation and demystify for you a little bit. So dementia is an umbrella term. It's a general term for symptoms. And there are many different causes of physical changes in the brain. It refers to significant problems with cognitive function. These can include memory, reasoning, problem solving, controlling one's emotions, learning new information, language skills, visual perception, attention, or personality changes. And it's really going to interfere with daily life activities and relationships. So again, we're talking about dementia. That's the umbrella term. And underneath dementia, there are 80 different kinds. And each type of dementia refers to either a grouping of the symptoms or the physical changes that are happening in the brain. And this is why this topic can be so confusing. Sometimes I will relate this to the way people talk about cancer. So if the doctor were to say to someone, you have cancer, a natural question might be, what type of cancer? Well, you have lung cancer. So now we know that there are cancer cells growing in the lungs. So if a doctor were to say to someone, you have dementia, a follow-up question could be, what type of dementia? Well, the answer to that could be Alzheimer's disease, because we've done a brain scan and we've noticed plaques and tangles of protein in the brain, and those are indicative of Alzheimer's disease. And then also your symptoms are indicative of Alzheimer's disease. So hopefully that kind of helps you understand how dementia is this umbrella term, but there's different types underneath. And I'm not going to go through all 80 types of dementia. We would be here all day. Some of them are very, very rare. I would like to talk about the most common types of dementia, so that you have an understanding of what each one is. And hopefully it will help you understand why it's important to get a diagnosis of a specific type of dementia, because then you're going to know what physical changes are happening in the brain, maybe even what area of the brain is affected, and you're going to know what symptoms to expect, how the disease might progress over time, what support might be needed, who might be needed in the care team. So having this information and knowing the specific type of dementia can really help improve quality of life as an individual is living with dementia, and can help people understand that personality changes are not coming from purposeful willfulness, or the person's not doing it on purpose. There are actual physical changes happening in the brain, and that the person is trying to run a race with a broken leg is often the way I describe it, but no one can see that broken leg. And I think that's what makes it really challenging, is we don't always know what's causing the exact symptom, but we often know that the person is not able to control that symptom. So for example, if someone is having difficulty with their emotions, let's say they have lots of anger and irritability, people will often ask me, well, is that dementia or is that depression? And I think the way I think about that is, while if they have a diagnosis of both, and if both are being treated, then that isn't something that necessarily we as a family need to figure out. That's more a question for the doctor. Okay, the depression is being treated, but I'm still noticing a lot of irritability and anger, and it's affecting the person's quality of life and my quality of life as a caregiver. What treatments are feasible to help improve both of our qualities of life? And that's where the doctor is going to try and tease out, is it depression or is it dementia? And what interventions can be put in place to help with that? Is it a routine? Is it exercise? Is it depression medication? So that's where the doctor as part of your care team can be really helpful in managing some of these symptoms. Let me go on to talking about the most common types of dementia. I mentioned Alzheimer's disease. It is the most common form of dementia. Approximately 60 to 80% of dementia diagnoses. Almost everyone is diagnosed after age 65. I do want to mention something about the word early. So people sometimes say early onset, and that refers to the age that someone is diagnosed with dementia, or the age that someone is experiencing symptoms. I have seen that changed to young onset to make that a little bit clearer. The early symptoms I'm referring to here are early stage. So what symptoms are we noticing at the beginning of the disease, regardless of the age of the person, if that makes sense? So early on in Alzheimer's disease, the symptoms we might notice are those that are slowly appearing over time. They are ones that are short-term memory loss, apathy, or depression. Medications are available that may help treat the symptoms, but don't slow the disease progression. And as I mentioned a few minutes ago, the physical changes in the brain are often these plaques and tangles of two different types of proteins, and it may also include nerve cell damage. So again, I really want to highlight for you here that we're talking about physical changes in the brain that are causing these symptoms. And I think that's really important to remember. So next, I'd like to talk about vascular dementia. And I think a challenge here is that we are still, as a community, as a scientific community, working on improving the diagnosis process. And so it's 10% of dementia cases, but it could be half. And usually it's starting in ages 60 to 75, and it may appear suddenly because it's being caused by strokes or bleeding in the brain, and those things can happen suddenly and cause changes in language, impaired judgment, difficulty with planning, changes in movement, slow gait, or poor balance. And it depends on where in the brain the damage occurred. Sometimes Alzheimer's medications are used in this type of dementia as well to help with symptoms that, again, are not going to reverse these changes. And where in the brain, how many, and the size of the injury in the brain due to the vascular event is what's going to determine what the symptoms look like, if that makes sense. So this type of dementia is really talking about those vascular events in the brain, and the symptoms can look very different depending on what area of the brain is affected. Next, I would like to talk about frontotemporal dementia, or FTD. And this one is the second most common form of dementia in people under the age of 65, 10% of overall dementia diagnoses. And as you can see here, it occurs earlier. Late 40s to early 60s. And what we're looking at here are things that people often don't associate with dementia. So personality changes, behavior changes, changes in language like speech or understanding, changes in movement, judgment, I mean, all these kinds of things. But as you can see from that list, memory often is not affected. So I think because a lot of people associate dementia with memory, this type of dementia can go undiagnosed. So it's really important to know that dementia affects cognition globally, depending on the type, and you're really looking at any significant changes in any area of thinking. This is another great example of why diagnosis is appropriate, is really helpful, because Alzheimer's medications may not be effective with FTD. And so it's really important to notice that the person has FTD so that a doctor is not giving them Alzheimer's medications, which may not help. And we're talking about damage to nerve cells in the front and side of the brain. And this is named after the area of the brain affected. So in vascular dementia and Alzheimer's disease, we were talking about the mechanism of change in the brain. Was it a vascular event? Was it the plaques and tangles of Alzheimer's? Here we're talking about any physical change in the brain that is in the front and side areas of the brain, so the frontal lobes and temporal lobes. And there's not a common mechanism for how those changes occur. And I think this is one reason why dementia can be so confusing, is that the way the dementia is named has so many different ways that it's named, by the symptoms, by the area of the brain, or by the mechanism of physical changes. Now I would like to talk about dementia with Lewy bodies, which is 10 to 15% of dementia diagnoses. usually diagnosed after age 60. And this one does often have memory loss in the early stage and changes in movement, slowness, gait changes, balance changes, fluctuating confusion, visual hallucinations, so seeing things that aren't really there, or seeing something and thinking it's something else. So seeing a plant in the corner that is not very well lit and thinking that it's snakes is a good example of this, as well as sleep disturbances. Medication concerns is certain types of medications may be contraindicated, like anesthesia or antipsychotic medications. And the changes in the brain are caused by Lewy bodies, which are abnormal clumps in the brain of a certain type of protein that leads to this type of dementia. So again, people may not think that fluctuating confusion or changes in gait or visual hallucinations are a part of dementia, but they can be. So it's really important to know about these different types. Now, just to make things a little bit more confusing, there is mixed dementia. So that is when more than one cause of dementia occurs in the brain at the same time and you get a mix of symptoms. And this could be up to half of dementia diagnoses. And again, it may not be clear exactly what symptoms are coming from what type of dementia. So this is why, again, it's so important to talk to your doctor, but I just want to mention this because people may not realize that more than one type of dementia can be occurring in the brain at one time. Okay, I know that was a lot of detailed information about different symptoms, but hopefully you found it to be a helpful overview. Now I would like to talk about what to do if you are someone that you know is worried about their memory. Now we kind of know what to look for, and I've probably said a bunch of times over the course of this presentation, talk with your doctor, and that's because it's so important. Those annual wellness visits include assessment for changes in cognition. Once you know the cause, you can get the right treatment. It could be treatable and your changes in thinking or memory could improve. But if it's something more serious, then you can learn what's causing it and take the next steps to get help and support, which is so important. I think once we have a name to something, once we know what is the cause of something, as scary as that process can be, it can also be a relief to know that, oh, it's not me, it's this physical thing happening in my brain that is causing this. And that can be really helpful as a way to frame those changes that are occurring. So now I'd like to talk a little bit about the diagnosis process, and I'm not a doctor, but this is sort of generally speaking what doctors might do through a dementia diagnosis process. Again, this process is always evolving and changing. And to diagnose dementia, again, the doctor will first look at whether a person has an underlying treatable condition, ones we talked about earlier, and if that condition can be treated in order to reverse or change, return to previous of the memory or cognition. The doctor will often ask about a medical history, as they seem to always do when we go to the doctor. So especially with changes in memory or cognition, they're going to ask, when did the symptoms begin? What do they look like? What changes in behavior or personality are you noticing? Are there any medications that, or activities or events that seem to make symptoms worse? And then a physical exam to look at blood pressure, other vital signs. Is there something else going on that may be treatable for dementia? And lab tests do the same. They may also look at cognitive and neuropsychological tests. And these may happen after a referral to a neurologist or with a primary care physician. And these are going to assess memory, problem solving, language, math, and other abilities related to cognitive functioning. And they may be short, they may be quite long. A psychiatric evaluation would help determine if depression or other mental health conditions are contributing to the symptoms. And then brain scans that can help identify strokes or tumors, any other physical problems in the brain that are causing dementia. and they help identify changes in the brain's structure and function. So those are very important. A question I often get asked is, what if the person is not aware of the changes they're experiencing in their cognition? How can we make the doctor aware of those changes so that the person can get the treatment that they need to improve their quality of life? And oftentimes, I have heard that doctors will receive a note ahead of time describing what's going on and asking for assessments to be made. And possibly even you can share information about how the person might respond to a conversation about their cognition, what the main issues are around safety or quality of life. And of course, we never want to go around anyone, but we also want to make sure that people that we care about are living their best lives. So it's really about how can we get that person help in a way that feels right to them. And sometimes people want to be a part of that process, and sometimes people are very resistant to being a part of that process. And so age can help with some of those strategies and brainstorming as well. So we've talked about a lot of these things briefly, but I would like to talk about them in a little bit more detail so that you know what exactly you can do in your daily life to help promote brain health. And as I've mentioned, what's good for overall healthy aging is good for brain health. Scientists used to think that brain cells inevitably die off and are not replaced as we age. And that concept led to the belief that nothing could be done to alter the inevitable changes in the brain. But we now know that certain interventions can help sharpen cognitive processes. So that's what I'm going to talk about. Again, there's no guarantees, but these are things that you can do that hopefully promote your overall health and maybe even promote your quality of life. So talking about your overall health, I've mentioned pretty much all of these, but again, at those regular well-check visits, if the doctor is not asking about these things, which they should be, that you as an advocate for yourself or your family member is asking about these things at the doctor's visit to make sure that you are having the best quality of life that you can. I'd like to talk about physical activity. And physical exercise has not been proven to prevent or reduce the risk of dementia, but emerging evidence suggests that it may play a role. So it's, again, important to make sure that it's going to be safe for you. So starting, if you're not used to exercising, starting small and slow, and working up to 30 minutes on most days, and incorporating different types of exercise. This can help possibly reduce the risk of dementia, improve connections among brain cells, improve heart and circulatory system health, reduce your risk of diabetes and stroke, help with depression, prevent falls, and even support independence in day-to-day activities, something that's very important to all of us, but I've heard a lot of older adults talk about how important independence is to them as they age. And so this is a great way to be proactive in supporting our own independence. And then eating healthfully. This is something that can be a bit of a challenge. We all love to eat, or some of us love to eat those sugary, salty, fatty foods that can be so delicious, but we really should be eating the smallest amount of those. And then as we get to the bottom here, the greatest amount of vegetables. So a number of studies have found that a diet rich in vegetables, especially green leafy vegetables and cruciferous vegetables, such as broccoli, are associated with a reduced rate of decline in reasoning and understanding. And then also keeping in mind proper portion sizes and adequate fluids. All those things will help give your brain the nutrition that it needs to perform the best that it can. And of course, if you have any questions about your diet and what you eat, talk with your doctor to make sure that whatever you're eating is in line with your overall health, because there could be other conditions going on that diet might affect. So having fun and staying socially connected, this is something that I think is getting to be more and more challenging for all of us right now. Emerging research suggests that doing activities you enjoy may help maintain well-being overall as you age. So doing things that you enjoy, doing things that are meaningful. They've done studies that people who do things that are meaningful say that they feel happier and healthier. Some studies find lower rates of dementia among people who stay socially active and connected with others. Although, again, no specific activity or lifestyle change has been shown to prevent or slow dementia. Reducing stress, so high stress levels impair learning and memory. That's been found in studies. So making sure that you find a strategy to reduce stress that works for you. Exercise, meditation, things to look forward to, doing fun things. And meeting new people over common interests can be a great way to kind of combine some of these things. You can do things you enjoy, you can do something meaningful, you can have something to look forward to, you can exercise together. So these are great ways and fun ways to support brain health. So I get asked a lot about brain exercise, and studies have found that engaging in challenging cognitive tasks may protect against age-related decline in thinking and the risk of developing. And the questions I often get about brain exercise is, what should I do? Should I do this one or that one? And it's really a very personal decision. Things that you might look for are learning new things, something that is enjoyable for you and personally relevant for you. Research has found that if it's enjoyable and personally relevant to you, it is more effective. And it should be challenging, but doable. And this is where doing it with someone else can be helpful, because you can both be challenged together. I think sometimes when we're doing something on our own, if we hit a challenge, maybe we're reluctant to keep going. But do try to challenge yourself, but have it be mostly doable. There's no grades in this, right? We're just trying to exercise our brain by playing games or doing puzzles, reading and discussing something that we've read is a great way to get brain exercise, even reading aloud. Watching something that interests you and talking about it with a friend or family member, going on a virtual tour of a museum, again, learning new things, and just being exposed to new things, and then talking about or applying what you have learned, I think is a great way to get brain exercise. So as I've mentioned, well, as we get older, we may need strategies to support new learning. And there's evidence that some of the difficulties that we have as we get older in storing new memories could be due to the fact that older adults don't spontaneously use strategies to really make sure the new information is encoded in their brains. And so some of these strategies can help support new learning and help remember things and help promote brain health as well. So here are some examples of strategies. Memory tools, so repeating a person's name when you meet them or trying to come up with an association to recall their name. Keeping organized with calendars, to-do lists, notes, or using a pillbox can be helpful. Taking more time to actively process new information, and you can see an overlap there. So if you're meeting someone new and you're trying to remember their name, instead of just saying, nice to meet you, you can do, nice to meet you, Bob, and then in your mind, think of something to help you remember Bob's name. And that is taking more time to actively process that new information. Following a routine, putting frequently used objects in the same place, like a key spot by the door, and then coming up with your own cues and strategies to help yourself. So whatever makes sense to you, whatever works for you is more likely to be effective. So that's a really important thing to take note of. So I know this has been maybe a lot of information, so I wanted to just talk about how to get started, because it can seem like, oh my goodness, I need to change my diet and exercise 30 minutes every day and visit the doctor, and it's just a lot. So I really wanted to just talk about some small things that you can do to promote your brain health and how you can get started today. So choose just one thing, one small step where it feels easy that you would be successful. And then think about how can you combine benefits for brain health. So taking a 10-minute walk a few times a week. And maybe on your walk, you're talking to a friend and you guys go for walks together on your phone. Adding one serving of vegetables a day. Maybe you combine with a family member and you decide to try a new vegetable every week. And so you're adding that serving each day or even each week. Making an appointment for a physical exam or a well check. Make sure that you have a plan. Write down what you plan to do and when you're going to do it. And get support from family and friends. Make it be something that you can come together on, increasing that social connection and making it more fun. And then stopping to celebrate the small victories. So notice how you feel when you succeed and take a minute to celebrate that in whatever way feels right to you. And that is really a way to make this fun and exciting for yourself. That's just a few ideas for how to get started that hopefully makes this feel a little bit more manageable for you. I've mentioned this a little bit throughout my presentation, but I really just want to take a few minutes here to acknowledge that this is a hard topic to talk about. And there are a lot of challenges around noticing these changes and having these discussions. I work with older adults who are living with early stage memory loss and their families. And I know that these things are difficult to talk about and that it can feel overwhelming. And just to say that it's okay to feel however you feel when memory challenges come up. There's an emotional aspect and a practical aspect. And I think it's important to acknowledge and work with both. You aren't alone in these challenges, and there are organizations like AGE, and we're here to help with support and resources. Aging and changes in memory or cognition have a lot of stigma in our society, I think, and that can make it really difficult to talk about. On top of that, as humans, we're reluctant to admit our own shortcomings, and that can sometimes lead to a lack of insight into our own cognitive changes. People are often reluctant to go to the doctor. How will going to the doctor help? I don't want to talk to the doctor about this. And that can also be tied with a fear of losing independence. If I go to the doctor and I get diagnosed, I'm going to lose independence and lose control, and the people around me are going to make all my decisions for me. And actually something that I've noticed in my work is that if a person gets help early, it is actually more likely to maintain independence because that person can then get help in the strategic areas where it is needed, and then they can remain independent in all of those areas longer. It can be so hard to ask for and receive help, but I think that almost all of us love to give help. So maybe thinking about how can I receive help because that's a gift that someone else wants to give to me. So maybe reframing that a little bit. What if I'm diagnosed with dementia? How am I going to feel? What am I going to do? And know that you're not alone. There are many people who are going through this. There are organizations that are here to help. And you are not alone. People often wonder, how is getting a diagnosis helpful? And I've talked about this. But once you know what the issue is, it can be easier to face it. You can create a care plan and a support team and really face it head on and help maintain independence and quality of life in whatever way that looks like to you. And family and friends can help if someone is concerned about their memory or if someone is diagnosed. You can help that person live the life that they want to live as much as possible. You can support that person in staying active, going places, keeping up with routines. You can answer their questions. You can help them keep routines like taking their medicine or go to them for doctor visits. Some specific strategies that people use, families have used to support the person with dementia in the home could be a big calendar to highlight important dates or events, a list of the plans for each day, notes about safety in the home, or written directions for common household items. So there are lots of strategies and tips out there for helping to support someone with dementia. And I think by acknowledging that help is needed, I think it opens the doors to getting that help and support, which is really important to living a good quality of life. So we at AGE are here to help, and I just want to talk a little bit about the ways that AGE staff can help support you in this process, so we can answer questions and provide information, refer to community resources. We have care partner support and education, and we also have small group virtual activities for people living with changes in memory or cognition. So we have an information and resource center. We have a Caregiver U, which is evidence-based classes, professional training for the family caregiver. We have our HELP program, which is free durable medical equipment and incontinence supplies. Our computer lab offers peer-based computer classes. We have 2 wonderful Thrive Social and Wellness Centers that have returned to offering in-person services to much smaller groups in a very limited capacity, but we are still offering that service. The Memory Connections Early Memory Loss Support Program, those in-person services are currently not operating, but we are offering a new program called Virtual Connections, which is those small group virtual activities I just mentioned. Virtual Connections is a monthly subscription program that offers small group virtual activities, and it is designed to meet a person wherever they are in their changes in memory or cognition. So we talk one-on-one with you to learn about needs and goals, and then we create a plan of service that's designed for you. So we create a schedule of individual services customized to you and your goals, and we connect you to vetted service providers in the community to help you reach your goals. And this is such a great way to build social connection, get stimulation, be engaged with others, make new friends, have fun, whatever your goals are right now. We try to provide small group activities to help you meet those goals, or find another provider that can help you meet those goals. So we're really trying to help with social connection right now. Would love to talk with you more about the Virtual Connections program. My contact information is at the end of this PowerPoint as well. So these are some of our wonderful Memory Connections participants when we are meeting in person. And I just wanted to take a moment to say that a lot of the stories that our culture tells us and that we often tell ourselves can be negative, whether it's about aging or about changes in memory. And at AGE's programs, Memory Connections, Virtual Connections, and our Thrive Social and Wellness Centers, we focus on the positive. We focus on what people can still do, on the abilities and experience and wisdom that remain. And we accept our participants where they are in their lives, where they are in their journey with aging, and where they are in terms of their changes in cognition. And we try to create a supportive environment where we encourage them to be themselves, as well as be proactive in their brain health. And so here are some of the quotes of from our Memory Connections people, that's the things that they enjoy about coming to some of our in-person programming that I think is still true of our virtual programming as well, that they are able to find this community of support as they are living with changes in memory and as they are aging. Thank you so much for your time. I hope you found this information useful and helpful. And I'm going to turn it over to Rob for our Q&A portion. It's been such an honor to share all this information with you, and I look forward to answering your questions and helping in any way that I can.
Thank you so much, Casey. great information, lots and lots of information, and we do have some wonderful questions. Before we get to those, I'm going to give you just a very quick break so that you can catch your breath, and I'm going to share one more video with you. It's from our friends over at Baylor Scott and White Health, who are our sponsors today and for the whole week, with some great information from them.
At Baylor Scott and White Health, there's nothing more important to us than your well-being. Over the last several weeks, we've done a number of modifications to our emergency room so you can continue to get the care you need when you need it. We're regularly cleaning and disinfecting frequently touched surfaces in our lobbies and patient areas. When you arrive, a screener will check your temperature, and we're requiring everyone to wear masks. When it comes to registration, we've got a no-touch process. You just answer a few simple questions. We'll get you back to our room as quickly as possible. We want you to be well informed and not ignore symptoms that could indicate a potentially serious condition. In those situations, it's critical you don't delay. To learn more about all we're doing to help keep you safe, visit bswhealth.com/safecare.
You know, as Casey mentioned, it's that early diagnosis that is so important. So even though we are in the middle of COVID and it's difficult sometimes to try to get to your doctor, it is very important. There's telemedicine that's available widely. And so if you think that you're having some kind of an issue, go talk to the doctor. Casey, we've got some great questions that have come in here. So let's start in on these. One question was about anesthesia during surgery. One person is concerned that their loved one is 78 years old and wants to know if the anesthesia can cause dementia-like symptoms, and at what point is a reasonable amount of time to consider it's the anesthesia or it's caused something else.
That is such a great question. And I think it's really an individual answer. And of course, I'm not a doctor, I'm a social worker. So it's a great question to ask the doctor about that individual. Generally speaking, what I have heard is that it's not necessarily the anesthesia that causes changes in cognition. It could just be the overall difficulty of an entire body going through some type of surgery process. And if someone is already experiencing changes in memory or cognition, any significant change in their life may cause an increase in symptoms because it's a disruption in their routine. So what I'm often telling people is if you are caring for someone who has changes in their cognition, who you are concerned may have dementia or has a diagnosis of a dementia, and a doctor is recommending a procedure that involves anesthesia or surgery, it's important to ask the doctor, how will this affect their memory or cognition? Should we expect an increase in those symptoms? If so, for how long? Have you seen this in your patients before? If the answer is yes, there's going to be an increase in symptoms, then I think the family and the person has all the information they need to talk about the pros and cons of that procedure.
So have that conversation before, have it early.
Yes.
And then you have the information that you need to make that decision.
Yes.
You know, we talked about physical exercise. I want to give a shout out to our partners over at the Pflugerville Community Church. They have a tremendous seniors exercise program that has been going for quite some time, and they are continuing to do even during the lockdown. They're doing it during Zoom. They have got senior exercise classes each week. They have breathing, balance, and flexibility classes. And as soon as we're able to meet in person again, they're going to add dancing. So
that's awesome.
It's a free, absolutely free, right here in our community opportunity. Take advantage of that. Also, Baylor Scott and White, if you are in the Pflugerville area, the brand new medical center there also offers a lot of great health exercise programs. They have a walk with a doctor program that once a week you go out to the park and you walk with the doctor, so you're getting your exercise, but you've also got a medical professional right there where you can kind of pick their brain for free. So there's lots of great resources that are in the community. Of course, you can contact Age of Central Texas. We've got lists and lists of those things that are available. But at least to one of the questions, which was about how does brain injury from physical trauma, we talked about falls, things like football injuries, and injuries that we've had while we've been exercising. How does that play into all of this when it comes to memory loss?
Yes, that's such a great question. And of course, it's very individual, as all of this is, and a great question for the doctor as well. But anything that's going to cause a physical change in the brain is likely to affect our memory or cognition, because it's affecting our brain cells, it's affecting the way the brain cells communicate with each other, it's affecting the inflammation in the brain, and could even affect the overall size of the brain. So brain injuries early in life or late in life, I think, can definitely be a contributing factor.
You know, we're reading a lot now about the coronavirus and COVID, and how that they're seeing in some patients that there are cognitive changes after they have gone through having the virus. And so we're not sure what that's going to mean for the future for folks who have lived through it. But you know, once again, a shout out, go get your flu shot, because, you know, flu as well can affect your cognitive. Anything that happens to your body physically is going to happen to your brain, because your brain is your most important organ that's running the show. Speaking of that, got a question about, you had talked about being able to remember names, remember words and objects. Wants to know if there is a good way of being able to retrieve some of that. That you had mentioned that with age, that is a potential, that, you know, the memory is not lost. It just takes us a minute or two to find it in the Rolodex.
Mm-hmm.
Are there some good tricks or some good exercises that folks could use to help them in being able to more easily retrieve that information?
Absolutely. And I think working with a speech therapist is a great way to find strategies that will work for you in your environment, in your home. And if you're noticing changes in cognition and you ask the doctor about speech therapy, sometimes they can write a prescription for that. And then you can have a speech therapist who will work for you, and it can be covered by insurance. So I think that it is, again, very personal. So it's about finding what works for you. So for objects, having a spot where you always keep an object. And then I think having visual cues can be really important. So if there's a place you always put your remote, maybe have a Post-it there that says, it's in a bright color that says remote. So you know that's where you always put it, and it's that visual cue to put it back as you're forming that habit. Or a hook by the door for your keys with a sign that says keys. Or I've even seen people, you know, put a sign on their front door that says, you know, wallet, keys, phone. What are the things, glasses, you know, what are the things that I need before I walk out the door? And I think in terms of remembering people's names, you know, it really is very personal. But if you can think of something that reminds you of the person, that rhymes with their name, or where you met the person, or even if, let's say, you have a partner or a care partner who goes places with you, have a setup with them where they know that you forget the names. And then when you walk up to someone, you say hi, and your person says, "Hi, Rob, it's great to see you again. We've missed seeing you since we saw you at dinner a few weeks ago." And they're providing all those cues to the person that may not remember. And then that person can say, "Rob, it's great to see you." And it kind of flows a little bit seamlessly. So I think it really takes some strategizing and brainstorming and some trial and error to find out what might work for you. And I'm always happy to talk with people about their specific situation to help them find things that might work for them.
You know, that's a great idea. You know, we are creatures of habit. And so developing that habit is a great way of keeping things going every day in the same way. You were talking about the introduction when I was a journalist. I would meet dozens of people every day, and I would see someone and I knew them, and I could not think of where it was. And so I had the same setup with my partner, which was the cue was if I introduced them first, then that was the cue that I cannot remember what this person's name is. So someone comes up to me, oh, hi, Grace, so good to see you again. It's so great to see you. Bob, I'd like you, I'd like you to meet my friend Bob. And then Bob says, hey, I'm Bob, what was your name? And then that person gives their name to Bob. And then you're going, aha, that's who it was. Now it's coming back to me. So,
yes, it's such a great way to do it. And I also sometimes will say if there is going to be a large gathering, like at, let's say, a church event or a senior center event, just make name tags required for everyone. Because this is something I think that we all struggle with. So if we're all wearing name tags, then we're all covered.
That's a great idea. Got another question here. We talked about sleep earlier and how that sleep difficulties can cause either cause dementia or can be a good indicator. It says, is early morning waking up a normal part of aging?
Oh, that's such a great question. I don't have an answer for that. That's a great question for a doctor. I mean, I do know obviously the changes in sleep happen as we age. I think it depends on why the person is waking up. Do they have, these are some of the questions that I will often ask if someone says that someone is having difficulty with sleep. Do they have a routine during the day? Are they getting enough exercise during the day? Are they napping a lot during the day? What are some things that can be done during the day to help promote a full night's sleep? And there's also early morning waking, like they used to get up at 8 and now they get up at 6. And there's early morning waking, like they used to get up at 8 and now they get up at 2, right? And so some of those things, there's a range there. Like at what point is it affecting the quality of life of the person or the care partner?
And, we also have to realize that right now, everybody's world is in a tailspin.
That's also true.
With COVID and the culture and politics, and it's kind of hard to sleep through the night sometimes because there's so much coming at us every day. It's hard to turn our brains off. But I think you're right. If it looks like a change is happening in your normal routine, that's something to talk with your doctor about. Let them try to parse out maybe what the issue could be. Got a question about statin drugs, if those have been shown to cause dementia. We know that we've seen a lot of studies recently in the news about certain medications that we need to watch out for. And obviously we don't want to combine medications without the doctor's okay. But are statins something that we've seen on the radar that we need to kind of watch for?
That's not something that I have heard of as a contributing factor. But again, I think every person responds to medications differently. And the main thing that I've heard of is, regardless of the specific medication, it's really the side effects or the interactions that we need to watch out for as causing those changes in memory.
And one person is asking about, they've got someone that has moved in with them during COVID, because right now, a lot of us are having to take care of each other. And so we've got a lot of people that are combining their households because that's really the easiest way to get through this, and have noticed that there are changes in this person's behavior. And not real sure whether it is just what's going on in the world or if there's something going on. How would you recommend for someone that, something's doesn't seem quite right with mom or my husband or wife? It's always a very difficult subject to bring up to the person. As people, we get very defensive very quickly because, human beings are animals, and we do not want to be the gazelle limping on the Serengeti in front of the lions.
Yes.
So, we're going to say, oh, everything's fine, don't worry about all that. But how can we have that honest conversation with someone that I think something's wrong and we really need to go to the doctor?
That is so challenging. And you're absolutely right. None of us like to have our weaknesses pointed out by someone else, right? We all want to hide our flaws and be strong and independent and think that we're doing our best and we're doing great. It's really hard to say that we need help. And I think it is a very personal decision how to bring up that conversation. So in my role is really to help families strategize about what might work for that individual. So I think keeping it positive, strengths-based, and person-centered is always really helpful, as well as not making it personal. So let me give you an example. If it's a recent move, starting with, how are you feeling about moving in? How's it going? And if they're like, oh, everything's great, then it might be, well, I've noticed at breakfast, you seem grumpier than you used to be. How can I make breakfast time more enjoyable for you? No, it's fine. So maybe starting by having these like very small conversations about quality of life is one way to do it. Another way to do it is to have it come not from the family member, have it come from a professional. Like I was saying earlier, send a message to the doctor with what are the symptoms that you're noticing? What are the frequency? How is it affecting the quality of life? What are the big changes that have happened recently? And then go to the doctor with the person and have the doctor bring it up. Again, we don't want to be sneaky, but we want addressing concerns to go as positive as it possibly can, right? To go as well as it can. And what I've learned in my work is that if it's coming from a third party, it can be the exact same question, the exact same conversation, but sometimes it's received in a completely different way and often in a better way. Or if it's negatively received, then you leave that professional behind and you have a scapegoat, right? If the person's mad, you're like, oh, that professional, they were rude, they were mean, let's go see someone else, right? And then try again with someone else.
Mm-hmm.
So it kind of takes it out of the relationship between the two people. Another idea could be talking about someone else. Hey, I had a friend who went to a presentation about changes in memory, and she learned these things. Just like we all look out for signs of diabetes, let's all look out for changes in memory. Let's all look out for changes in depression because it affects quality of life, and make it global, not about that individual. So those are just kind of some of the initial strategies I might suggest, but I think for everyone it's going to be different.
And because it is different for every person, I want to go back to one thing that you said, which is that no one is ever alone in this journey. And Age of Central Texas is here to help with that. So we have a resource center. We have our wonderful staff folks here who are social workers who can help you with the ideas, with a plan, whatever it is you need to help you make that journey successful. So we recommend, please give us a call, send us an email, let us help you with that, because since every person's need is individual, we can help you come up with a plan. We can hold your hand, we can guide you through it. So, and our services are free for you for that. So please give us a call, send us the email, let us help you individually with that, because it's going to be different for every single purpose. We're running low on time, but we do have one more great question, which is about diet sodas. We've seen a lot in the news about diet sodas being not so great for us, and that some studies have shown the possibility that they can affect memory and cognition. What have you seen in that realm?
I have not seen anything specifically related to diet sodas, but I might just take this particular example and put it in the category of things that we love to consume that may not be the most healthy for us. that we're at the top, the smallest portion of that food pyramid I showed earlier. And just really highlight that while it's important to promote brain health, quality of life is also important. So if one diet soda a day makes a person's day absolutely fabulous and is like the highlight of their day, then taking it away to promote brain health may not make sense for that person, right? And I think a lot of it is about finding that sweet spot of balancing safety and health with quality of life, especially health and quality of life. Safety always comes first, but that would be my suggestion around that.
You know, moderation, we hear all the time, that's the way to go. And just always remember, everything that goes in your mouth ends up in your brain. Whether it's medication, whether it's alcohol, diet sodas, those good leafy green vegetables that we should be eating, those, everything affects your brain at some point. And so we always talk about, exercise, eating well, and socializing are the three things that you can do yourself that will help you live a longer, healthier life.
Yes, and I think something that's really important is just noticing how you feel, right? So when you eat a certain thing, how do you feel? When you drink a lot of diet soda, how do you feel? And so making those decisions and taking those steps to feel the way that you want to feel and to have the life that you want to have.
And it's one step at a time. It's not everything all at once. It's one step at a time to get to where you want to be. Mm-hmm. Again, Casey, thank you so very much.
Thank you.
We appreciate it very much. We appreciate you spending the time with us this morning and letting us share all this great information with you. We want to leave you with two things to remember. Number one is that great new virtual connections program that Age of Central Texas has launched. There's information in the program that we sent to you in that link. Look at that PDF. Give us a call, send us an email if that's something that could be of use for you. And also remember, you are not alone, that we are here to help you no matter where you are in your journey. And there is absolutely never any shame for asking for help, especially when it is here for you for free to utilize. So please take advantage of it. We thank you so much for joining us. Tomorrow, we're going to conclude our Pflugerville Seniors Conference. We're going to talk about legal issues. That's always a topic that's very popular. And Keith Ludy from the Ludy Barnett Law Firm is going to talk about all the things you need to know as you age on keeping yourself financially and legally safe and healthy. So we hope that you have a great rest of the day. We've got a cold front coming through tonight, so tomorrow's going to be wonderful. And we will see you again tomorrow at 10 in the morning. Thank you, KC. Thank you for joining us. Have a great day.